Hello, everyone. Welcome to the second webinar of the AFD's Research Department webinar series called Research Conversations. My name is Felipe Correales. I am an economist and I work at the Research Department of the French Development Agency, where I am part of the coordinating team of the Research Facility on Inequalities. The Research Facility on Inequalities is a research program led by the AFD and founded by the European Commission that was launched in 2017. And since then, more than 22 projects on inequalities have been carried out in about 20 countries around the world, where we have worked with local universities or research centers. Today, we will have the privilege of seeing the presentation of one of the projects that was part of the research facility, the report on multidimensional inequalities in Vietnam. This project has been jointly led by our partner Oxfam Intermón and the Mekong Development Research Institute. I would like to take this opportunity to thank both institutions for their hard work. As you are about to see, the results are really interesting, not only in terms of research, but also in terms of recommendations for public policies. The report is public and free to download. So I will leave the floor first to Mrs. Thi Quynh Hoa from Oxfam Vietnam, who will introduce the project and share the importance of having carried out a study on inequalities in Vietnam. Mrs. Hoa is the head of campaign and advocacy in Oxfam Vietnam, with more than 20 years of experience working in the development sector, with substantial knowledge on issues of poverty, inequality, governance, women's rights, education, and experience in research, policy advocacy, and campaign work. Then, we will leave the floor to Dr. Phung Duc Tung, who is the director of the Mekong Development Research Institute. Dr. Phung holds a PhD in economics from the Institute of Development and Agricultural Economics, Leibniz University of Hanover in Germany, and he possesses a strong background in econometrics, impact evaluation, and survey design and implementation. His research areas focus on poverty reduction, socioeconomic development for ethnic minorities, social welfare, and vulnerability to poverty. The presentations will take about 35 minutes, and after that, we will take a moment to answer all the questions you may have. In that moment, I will invite on stage the researcher from Oxfam and the MDRI that contributed to the process of this report. So before we started, I would like to bring your attention to the top right of your hand corner of your live stream page, where you will notice two tabs, the question one and the chat one. Please feel free to use the chat for any comments, but submit any questions in the questions tab, and if necessary, specify to whom the question is directed. So without further ado, I will leave the floor to Mrs. Hoa.
Thank you, Felipe. Hello, everyone who are joining the webinar today. On behalf of Oxfam, it is my pleasure today to present briefly about MIF, the Multidimensional Inequalities Framework, and it's piloted in Vietnam. We would be very happy to welcome any comments from you at the end of the presentations. I will go directly to introduce with you about MIF, the Multidimensional Inequality Framework. So what is MIF? It is a joint collaboration between Oxfam and the Universities of London in 2017. The main purpose of the collaboration is to expand and deepen our understanding on inequalities, going beyond the analysis of economic inequalities and looking towards a more multidimensional inequality analysis approach. So MIF is a tool that could help us to look at the multi-phases of inequalities and analyzing of inequalities at individual and well-being level. It's also providing the analysis on causes and effects, or in other words, drivers of inequalities in countries. and it also offer a potential solutions for the public policies and beyond. So the approach of multidimensional inequality framework was built on previous work by the Equalities of Human Rights Commission in the UK. And this is a glance, a quick look of how does MIF look like. So it included 7 domains in life, where you can see here the pictures of 7 domains in life, which matters to everyone. For example, healthcare, education, employment, participation, influence, safety, self-expression, and self-respect. So the 7 domain is divided into 31 subdomains with 45 indicators and 177 measures. So it will help you to collect and analyzing the data from a multi-dimensional approach. The key importance of the MIF tool is it helps to look at the vertical, horizontal, and spatial inequalities. So it means that it looks at the inequalities. So it means that it's look at the inequalities. You cannot see the presentation right now. Can Felipe help with the technical support? Because I see one colleague saying that he cannot see the presentation right now. So I will continue to talk about it. So I was saying that the MIF tool will help you to look into the vertical inequality, so meaning that the inequalities among individual and household, or it also helps to look at the inequality from the horizontal approach, meaning that the inequalities among groups, among regions and spaces, etc. So for further information about the MIF toolkit, you can access to the web link here, inequalitytoolkits.org, where you can find very detailed information briefly about what MIF is about and how it is implemented, and also detailed look into the 7 domains and 31 subdomains. So about the motivation for Oxfam, so why Oxfam is adopting MIF, so few things to highlight and share with you. Firstly, tackling inequality is strongly embedded into Oxfam's strategy, both globally and at the country level, like Oxfam's in Vietnam. And in 2015-16, Oxfam globally launched the inequality or Even It Up campaign, contributing to shift the debate on the issue of inequality, providing the solution on how to address the issue of inequalities. So the campaign is now implemented in more than 50 countries. So with the adoption of MIF, we hope that it will support Oxfam and partners in different countries to develop our understanding to be more comprehensive about different dimensions of inequalities. This can help to reinforce our program, our Oxfam and partner program and campaign work on addressing the issue of poverty and inequality. And we also hope to contribute to debate of inequalities, the evidence-based policy proposals, looking from a practitioner perspective. The MIF was started firstly in Spain and Guatemala in 2018-2019, and then it was expanded to Vietnam and Burkina Faso in 2019 and 2020. So about MIF implementations in Vietnam. So as you might know that Vietnam has very strong records on poverty reductions, and it has mentioned as one of the examples on the poverty reductions over the years at both national, regionally, and global level. However, research shows that inequalities exist when threatened Vietnam progress over the decades. That is the reason why at the national level, the government show very strong commitment to the 2030 leaving no one behind agendas, and strong commitment to SDG 10 on tackling inequality in particular. And the government also continues with the sustainable poverty reductions for the years of 2016 to 2020s and working beyond. In Vietnam, there are few research talking about inequality. However, the existing research mainly focus on economic inequalities, and there are very few research talking about the inequalities in opportunities, social mobilities. Therefore, there is a very high interest coming from national level to have an in-depth understanding on the issue of inequalities, especially looking from a more comprehensive approach, and in particular looking into the connection of different dimensions of inequalities and intergenerational characteristics, and how it's what the issues of inequality in countries. And finally, this will be my final presentation talking about quickly about Vietnam. Before I hand over to our partner to talk about the key findings coming out from the tested process. Here the pictures show the different process of how we piloted MIF in Vietnam. So it started with country identifications, working on an adapted version of the framework, where we zoom in and focus on the three key domains, that is on health, education, participation, voice, and influence. And then we organized the consultation workshop with key stakeholders on methodologies and how it can be better adapted in Vietnam. And we conducted the literature reviews, data collections, and then doing the qualitative field work and consultation with the work with the draft report. And then we did launch the MIF report and the report in November this year. Throughout the whole process, our expectation is to mainly on two things. One is continuously of inequality and poverty reductions in Vietnam, and then the second one is we are a little bit ambitious in terms of we very keen to explore on the possibility and collaborations to systemize the compilation of inequality related data to some of the national surveys, such, for example, like Vietnam Household Living Standard Survey, for example. So briefly, so I won't be stopping here. Briefly about the what is MIF and its introduction in Vietnam, and I would like to hand over to Philippe and inviting our colleague Dr. Tung to present more details about the findings coming out from the testing process. Thank you.
Hello, everybody. I will present the key findings from the first pilot report to measure multidimensional inequality in Vietnam. It will have 6 issues I want to talk about. First one is objective and method that Hoa already mentioned, why we try to do the pilot risk method in Vietnam. And then I will present 4 domains that we selected to measure in Vietnam. So first one is really popular measure in every country. It's a multi-territorial inequality, and then on health, education, and participation, and influence and voice. That 3 domains that we think it's very important for Vietnam. And also we consult with experts in Vietnam and policymakers, as well as to see the available of secondary data that we can use to measure. And the last one is about some conclusion and some key recommendations for the government of Vietnam. So the objective of the report is try to apply the multi-dimensional inequality framework that's already discussed to analyze the inequality in 4 domains applied based on the framework MIFs that developed by LSE and Oxfam. And from that, we try to identify the key driver of inequality in Vietnam in education, health, and participation and voice. And then from that, we try to provide some policy recommendation to reduce the gap. So the methodology and data source, we use both quantitative and qualitative methods. And first, we use secondary available data and use descriptive statistics, some index that popular used to measure inequalities, that Gini and tail index, and try to decompose by such population like ethnic minority and majority, urban and rural areas, and use small area estimation method to estimate poverty rate among ethnic minorities and location in Vietnam. And from that, we finding from quantitative, we will use qualitative to fill in the gap because the data, and also try to find the reason behind the finding from quantitative. And qualitative method, we use key informant interview to the commune and village leader, and focus group discussion with households and different gender and male and females. And we go to three provinces, Tuyên Quang in the north, Đắk Lắk in central, and Sóc Trăng in the south Vietnam. That can representative for three main regions in Vietnam. First, a theme about inequality in economic and assets. We measured by income, expenditures, electricity consumption, and housing value to see the inequality in Vietnam using Gini index, and we see that there is Gini index in expenditure, income, electricity consumption, and housing value remained really stable over time, not much increasing over time. So it's really consistent. However, the result is different by different indicator we want to measure. Like inequality in expenditure is lower than inequality in income, and electricity consumption maybe reflects that expenditure measure the data is not capture all of the expenditure of the households because the household survey the arts expenditure over 12 months, past 12 months, and maybe the respondent cannot remember all of the expenditure they spent over the past 12 months. And the inequality asset that we measure by housing value is much higher than income and expenditures. We see that national poverty rate is decreased over time, and Vietnam considered a most successful country in developing country to reduce poverty over the last 20 years. But we still have see that it's not even among ethnic minorities. The lowest poverty rate is belong to Kinh majority group and Hoa group, and highest poverty rate is Lahu, Lolo, and Mang, very small ethnic minority group in Vietnam. And you can see from the graph of Vietnam on the left-hand side, it's a poverty rate of Kinh group, and the right-hand side, it's a poverty rate of ethnic minority. And you see that even the Kinh people who living in remote and mountainous areas still have very low poverty rate, less than 20%, while the ethnic minorities in most of location in Vietnam have poverty rate from 40 to 70%. So it means that even living in the same place, the Kinh majority group still have a better living standard compared to ethnic minority group. The second theme is in inequality in health. So first, we try to measure results of the health, and the proxy indicator here is disabilities pupil. And we see that the non-degree group, so lowest education group, have a highest disability rate, about 7 times higher than group of professional high school, college, university, or higher education levels. The prevalence of disability also much higher in women compared to the men group. It's about twice. Particulars the disability in memory and focus. And the poor group also have high percentage of people with disability. It's nearly 4 times higher than the richest group in 5 quintiles. Disability prevalence of ethnic minority group is much higher than the king in all kinds of the disability. And proportion of people with disability in rural areas is higher than urban areas. 3 regions that have highest proportion of disability people is North Central, Central Coast, Central Highland, and South. And most of the disability people are in difficulty in remembering and focusing. And after that is the mobility of disabilities. In terms of the health insurance, the government have a very good policy in terms of provide health insurance to the poor people and the vulnerable group. And as you can see, that ethnic minority has much higher health insurance cards compared to king majority group. So highest is belong to Giao, Hmong, and lowest rate is king group. So it reflects the efficiency of the health insurance program for poor and ethnic minority people. Highest rate in terms of health insurance card also come to the poorest group and lowest to the near poor group. By gender, we didn't see much different between men and women in terms of percentage of people having health insurance cards. Only slightly different between urban and rural areas, but the difference is not significant. We found this positive correlation between education attainment of the household with the health insurance percentage. So the household have higher education level, the percentage of people in this household having health insurance cards much higher. Health insurance policy seem to be help the poor to have more health care or the chance to access to the health service than near poor. And this is a good policy, but in spite of the high coverage, the medical examination and treatment using health insurance card is not high, especially for ethnic minority. And one of the major barrier, I think, it's about the distance to the health service centers, and also some in terms of culture, norm, and perception. And as a result, we can measure by number of health visits at province and central hospitals. We can see that the king, even they have lowest health insurance card in terms of percentage people. They have highest number of visits to province and central hospital, where the health quality service is highest. While the Hmong group, or the poorest ethnic minority group, have lowest number of health visit to reach hospital. And one of the reasons is there's long distance between home and hospital for ethnic minority. And also, even you have a health insurance card, you still have to pay like 20% of the health cost. And then affordability is also the problem with ethnic minority and poor people, and limit a valid of the healthcare and cultural norm, as I mentioned before. And here's in focus group discussion in Sóc Trăng province, one male said that going out to buy medicine in medical shop is easy and it's cost only few thousand dong. So no need to go anywhere or go to hospitals. So it's related to perception. And in Vietnam, you can see that you can buy medicine easily without prescription of the doctor. And we measure the distance to nearest hospital, at province and central hospital, and you can see that Kinh and Khmer, they live very close to province and central hospital, while Mông, Thái, Mường, and Nùng, they live very far from province and central hospital. That's why they have a less chance to come to visit this hospital. The same as poor risk group, I have travel twice as long as other group to district and province or central hospital. So distance is one of the barriers for the poor and ethnic minority to access to the higher health service centers. We identify the four key drivers that creates inequality in health. The first one is an inequality access to the quality healthcare. It means that the poor and ethnic minority group only can access to lower quality healthcare centers because location, the living, because of flexibility, and also about perception of people. Inequality access to maternal and child healthcare, and thus lead to a high percentage of chance of the child being disability. And inequality access to clean water and adequate sanitation and good nutrition, especially for remote areas. Mode of drinking water is nature water and it's not safe and clean. And sanitation also a big problem in these areas. And we also found the negative social and cultural norm in some ethnic minority that also lead to the health risk. The third domain is inequality in education and learning. One of the indicators we try to measure is for the children, we know 5 years old having purchased toys. That is the data we can have us. And we see that the high hit rate among the rich ethnic group like Kinh, 84%, Mường and Khmer over 70%. While the poor group in terms of economic condition, Giao and Hmong is about 30%, so less than 2 times lower than rich ethnic group. And number of comic book purchase, Kinh, Tây, Mường, and Nùng also much higher than Thais and Giao. So we see that the children from rich households have more purchase toy and comics than those from poor households, and the difference is really quite high, about 37.7%, and in terms of toys, and about 5.2 in terms of comic books. One of the reasons also is that the limited awareness of household of early childhood development, especially related to parent education and the mothers who have low education. In terms of enrollment rate that go to school at all levels, Vietnam already achieved universalization in lower second education. However, enrollment rate also varies across ethnic groups, and we found that highest enrollment rate at preschool, kindergarten come to Lùng, Thái, Tây, Mường, and lowest group is Khmer. One of the indicators we try to measure the education quality is the math and literature score. We using the data from a nationwide test, Viet Nam, and we see that the highest score come to the student belong to Kinh, Mường, Tây, Lùng group, and lowest score is Khmer and Hmong, and the score is really huge gap between these ethnic minorities children. And education performance also have a really high correlated with the mother education level and also household economic conditions. When we look at the men and women, we see that for the people who already complete the education, a great number of years in school for women is much lower than men, but for current on school women or girls have a much higher enrollment rate than boy. So that is really surprising. The trend is now in favor education is favor for girls than boys. And between urban and rural, in terms of number of years in school, for people living in urban areas, it's about 3 years more than people living in rural areas. And enrollment rate also much higher in urban areas, about 1.5 times higher than in rural areas. Highest enrollment rate come from understandable two big economic reason in Vietnam is Red River Delta and the South. Lowest enrollment rate belong to Northern Mountain Upland and the Central Highland. Between rich and poor households, a huge gap in terms of number of years in schooling. People in rich household is 6 years more than in the poor household. It's really big gap. Why you know that average year in schooling of other people in Vietnam only 8.5%, 5 years. So the difference is 6 years. The member of education level also really positively correlated with the household education. It means that the children living in the household who have a household with higher education, they seem to be have more chance to go to school. And the major driver of inequality in education, the first one is we found the unequal access to high education, high quality education service. You can see the big gap between school in mountainous areas and in urban areas in terms of school facility, the quality of teacher and other like access to technology and internet. Also, one of the reason is harmful social and culture norms that affect access to education and learning, especially for in some ethnic minority, while perception of education is not appreciated, and they also lead the labor when their children after 9 or 10 years old. And in Vietnam, we do not have education system for disability pupil, and then it's the major barrier for them to go to school. Unequal access to early child development opportunity also one of the key driver that lead to inequality in education, and unequal access to career guidance, vocational and technical training, apprenticeship and internship for the student in lower secondary school and high school, and that lead to the big gap in terms of match with the labor market demand. And the last one is unequal access to book and technology and internet. The most of remote areas, the student cannot access to the internet, and that is also barrier for them to learning. And here's one of the assessment of the head primary school in Tuyên Quang province in the north of Vietnam. Students at the main school site enjoy better studying condition and participate in more learning activities, so they perform a bit better than students at satellite sites. Since the satellite sites are far away from main site, about 13 kilometers at the furthest, students are less likely to participate in collective activity. To some extent, in terms of communication skill, students are more reserved than students at the main site. So that is, you see the location and the distance is very important. And one of the thing related to perception is about the ethnic minorities. The head of the primary school also have some sentence sets up because Hmong people think that rich age is good to start working. The small number of Hmong family, in particular rich ones, encourage their children to continue their education, but the children themselves do not want to go to school. So it's related to the perception and culture norm is barrier for us children in ethnic minority to go to school and study in higher education. The last theme is about inequality in participation, influence, and voice. We lack of data, so we only use available data to measure this theme. And one of the indicator is proportion of individual voting in the election. And we see the very huge gap between high educated person with a non-educated person. The difference is about 20 to 26%, and also significant vary in genders, and it's up to about 17%. For example, men voting rate range from 86 to 89%, while women voting rate only 7 to 72%. And the same trend we can see from rich household to poor house, urban and rural areas, but small gaps in genders. We didn't see different in voting rate among ethnic minority. So it really interesting and surprising finding that we didn't see any different among ethnic group in terms of voting rates. And we see the voting rate for National Assembly central level are always higher than voting rate for people committee local level. So we are also very interesting finding. In terms of proportion of individuals correctly naming the prime minister, it's also a proxy for the political participation and awareness. And we see that the high educated people also have much higher, about 3 times than non-educated people. Women proportion is about half of the men, and the richest household of people also have much more than poorest group. And the same we can see between ethnic minority and the king group, and we see the same trend for General Secretary and Chairman of National Assembly. The second indicator is percentage of people contacting with local government. In 2018, we see the same trend that high educated person have more likely to contact with local government than non-educated person. The men also more than women, and rich people also have double percent of people who contact with the local government compared to poor rich group. And one of the same finding and also surprise is we didn't see any difference between ethnic groups. And the satisfaction rate with public service also do not differ between men and women, ethnic minority group, and income level. So that is also interesting and surprised. The next one is percentage of people submitting proposal to people committees. We see also the same chance that a higher educated person have more submitting proposal to people committees than non-educated person. Men also more active than women, and rich people are more submitting to people committees than poor one. But the difference between King majority group and ethnic minority group is very small, only 3%. And we think we see that's no barrier or discrimination in participation in political and public activity. And we think that the root cause are the language barrier and income and education different. That affect things perception. And in this theme, the key drivers of inequality in participation, influence, and voice is about income inequality and education inequality. The discrepancy in education level and living standards that lead to unequal in participation, influence, and the voice. And this second is the prevalence of harmful social and cultural norms, especially belong to gender discrimination, and reduce economic women empowerment and participation of women. Third one is ineffectiveness in encouraging the democratic participation of all population group, especially related to poor people and no educated people. Inefficiency in implementation of law that ensure transparency and prevent the corruption. And last part is about conclusion and recommendation from the finding of the report. We came up with 5 conclusions. The first one is inequality in health and education are among geographical, social, economically, and ethically different such group population group are perceived and reinforce inequity in other life domain. So health education are one of the major consequence of the inequality in others domain like in economic and participation and voice. Inequality in access to high quality healthcare service can lead to the result of human load or such as high mortality rate and low life expectancy among ethnic minority group and disadvantaged groups such as poor pupil and poor households. Relative similar enrollment rate in lower secondary school. However, education experience also vary. Ethnic minority children living in northern mountain areas have significant poor in terms of economic performance than King children living in better social economic areas, especially in urban areas. Inequality in participation also vary between men and women, rich and poor household, different education level, and rural and urban areas. The compounding inequality can be identified and unequal gender relation reinforce inequality in realm of public participation. So from finding and conclusion, we came up with some recommendations. The first, the government need to have some policy to redistribute the income between rich and poor people and have more for poor policy. For example, can impose more tax, not only on income, personal income tax, but also on assets in Vietnam, because asset like housing in Vietnam have very low tax and a lot of rich people try to buy a lot of real estate. So maybe impose a real estate tax and get some money from that to redistribute and invest on education and health. And the second is increase the long-term employment opportunity for remote area and poor people by invest on the collecting infrastructure that collects the remote area with industry role, and also try to introduce extension service to improve the agriculture activity. Because productivity of some major crops in remote area in poor where poor people live now have only half of national average. The third one is try to improve the healthcare service quality and accessibility in disadvantaged area. The first one is try to improve the facility of the health center, especially community health center, and also try to give some incentive like salary and other incentive for attracting a high and qualified health worker to go and working in this advantaged areas. Also, my offer travel expense support caregiver accompanying patient to visit provincial and central hospital, because when the patient come to reach a hospital, they need some accompany to take care of them, and it's cost a lot for the poor and ethnic minority household. And improve access to safe drink water in school and at home, as well as sanitation. The first one is try to improve quality and accessibility of education by some programs like semi-boarding school, and give some scholarship program for the poor and the ethnic minority household. Train the perception by about education of ethnic minority, by raise parent awareness about important and value of education. Give some career orientation and vocational training program to the lower secondary school and high school. The fifth one is critical thinking, active citizenship education and awareness raising program to empower women and disadvantaged groups. And the last one is in order to have a complete the report and analysis of multi-dimensional inequality in Vietnam, the government need to have better data collection and have a clear work plan about coming survey that can collect enough information and data for further analysis and disaggregate data. That's all my very brief presentation of the report. Thank you for the listening.
Thank you very much, Ms. Hoa and Dr. Phung, for these very interesting insights. It's super interesting. We have not received questions yet. I guess the absence of them is because everything was super clear. But right now, I will invite on stage from the Mekong Development Research Institute, Thi Quynh Hoa. He is an economist and a researcher analyst at the MDRI. And from Oxfam Intermón, Cristina Rovira, Senior Inequality Program Advisor. And finally, from Oxfam Vietnam, who is with OA, Nguyen Quan Thai, who is a researcher at Oxfam in Vietnam. So please do not hesitate to send your questions. We have some questions. I guess Cristina has some questions already, but do not hesitate to put it in the question as well.
Thank you, Felipe. And maybe I can just do a small comment while the public is starting to warming up and thinking about questions. I wanted to thank Hoa, who is head of campaigns at Oxfam Vietnam, and also Dr. Phung Duc Tung, the director of MDRI. I found the explanation and presentation very enlightening on this first attempt to examine multidimensional inequalities in the country. As Hoa introduced, Oxfam has piloted this framework in several contexts, at the national level in Guatemala and Spain, but also at the regional level in West Africa and Central America. And I think that the team in Vietnam succeeded in overcoming some of the challenges that actually we found when addressing, when trying to pilot this multidimensional approach. I think that the first challenge is that multidimensionality as such can be very overwhelming. As Hoa introduced, the framework has 7 domains, 31 subdomains, 177 measures, and in this sense, selecting the domains and building and pull out the inequality story that emerges from the big picture is key. And I think that through representation, the team has succeeded in identifying who are the key subpopulation groups facing capability gaps across these spatial, socioeconomic, ethnic axes of inequalities. And secondly, I think that breaking the silos between domains and subdomains can be very challenging. But at the end, this is one of the key added values of this approach, connecting and understanding the many dimensions of inequality in theory and practice, their intergenerational reproduction. So I think that especially between the educational domains and also the political and influencing and participation domains, we could see those connections as Dr. Tang was presenting. So thank you very much again, because I found it very, very interesting. So turning into questions, I wanted to start by throwing a couple. The first one, maybe to Hoa and also her colleague Thi, the team from Oxfam in Vietnam. I wanted to ask you, what has the multidimensional inequality framework and its capabilities approach allowed you to discover, to investigate differently, with respect to other studies of inequality carried out in the country in the past? So maybe building up on what I said before, in other words, for you, what was the unique added value of the multidimensional inequality framework? And maybe then a second question directed to the research team from the Mekong Development Research Institute. The research follows this mixed methods approach, with quantitative and qualitative methods in sequence. We could see actually some beautiful sentences throughout the presentation. So could you tell us more about this specific approach, and why did you decide to carry out quantitative and then qualitative methods in sequence? So we can start with those ones, and then we can follow up if the public suggests any other questions. Thank you.
Philippe, should I take the question first? Yeah. Yes. Thank you, Christina. You thank us, but actually we also would like to thank you, Christina, Alex, Brad, and also Philippe as well, because of all of the entire support and being very supportive and engagement during the whole process of implementations in Vietnam. So whenever we have some challenges understanding and unpacking, nationalizing the framework, so we come to you and then we discuss. So we really value the partnership and also the collaborations over the year that we have been able to bring the MIF tested successfully in Vietnam. And also, as I shared with you before, that the launches of MIF and the report in Vietnam also created a lot of the added value for us in terms of contributing to the debate on poverty reduction and inequality and tackling inequalities in Vietnam, but it's also opening up potential opportunity for collaboration because, for example, during the launch of our MIF, there was actually a request coming from UN, for example, to invite Oxfam and MDRI to come and present about the MIF and the multidimensional inequality analysis as part of their consultation and development of the strategy in Vietnam in the upcoming 5 years. And I remember that the testing of MIF in Vietnam also bring us the opportunity to have a future engagement with the policymaker in Vietnam. Because, for example, during the launch, there was representation participant coming from the ministry as well, and we found very surprised at the high level of interest coming from the policymaker in terms of knowing more details about the MIF framework, not only the 3 key domains that we have tested in Vietnam in the past year, but also other like 7 domains and all kind of the 31 subdomain and indicators. And maybe there is a very earlier interest saying that it can be a kind of like future collaborations for us to work together to further developing the MIF and using the MIF to systemize the inequality data to the national government-led survey. For example, like in Vietnam, we have Vietnam Household Living Center survey that will be conducted every 2 years, for example. So that would be complementary to the government-led national survey, and it's also complement to the government report on SDG every 2 years, for example. That is like a kind of what you asked, Christina, in terms of the added value to the teams here, opening up the future collaborations and work on the issue of inequalities. And internally, for Oxfam in Vietnam, for example, we also it also will trigger our motivation to continue to go into the more in-depth analysis of inequalities, especially exploring the interconnections of inequalities and how that's kind of the interconnection and the cycle of inequality can perpetuate the intergenerational inequalities. I think the testing of MIF in Vietnam has revealed, especially from the presentation coming out from Tung, it mentioned quite a lot about the interconnection of different domains, but how it is affecting the future generation and the hope for social mobility, for example. That is also an added value for us, an inspiration for us that we can continue to explore in the coming time. So maybe I will stop here. I'm not sure if Thi want to add anything more. Yeah, that's all from us. Yeah, I hope I had partly addressed your question, Christina.
Thank you, Hoa, and very interesting as well to hear on how this exercise of research can be enlightening, not only in sense of knowledge production, but also on influencing your local context and the influencing role that Oxfam has towards the local and national institutions in Vietnam. Thank you very much. Dr. Tung, it's your turn. If you want to just tell us more about the methods you followed on sequence.
Yeah, thank you, Christina, for the question. So the reason why we use both methods, the first reason is that you also see from our presentation that we do not have available data, secondary data available if we only use quantitative method to capture our indicator in 3 major domains that we want to measure. So that's why we had to do qualitative to fill in the gap in some indicators that we cannot calculate it from data. And the second thing is that some finding from quantitative, we cannot know the reason why. For example, why the education performance of children in poor and ethnic minority group is much lower than King majority group. It's because of the service quality rare is poor, or because perception of the households in poor and ethnic minority household they do not value the education. So that's why quantitative, qualitative is really important to explain the reason behind that, because demand side or because supply side. And if we have insight about explain the finding, then we can have better policy recommendation. So it's from education finding in the education inequality team, we clearly see that it's not only in terms of government can provide good school facility, a high quality teacher. It also they have to train the mind of the household who have children in replete in order to improve and reduce the inequality in education. So hope that it partly answers the questions.
Thank you very much, Dr. Phung and Ms. Hoa. There is one question, and we will extend the webinar for 5 more minutes in order to ask the question that has been raised. So the question is from Thi Lee, who asks, while I understand the MIF's usefulness for international comparisons of multinational inequality, to what extent should locally relevant specific indices like inequality in social connections be developed in later analysis? What may be gained or lost here? Dr. Phung, Ms. Hoa would like to respond to this question.
So Hoa, can you answer that question or me?
Can you go ahead?
So actually, I'm not fully understand the question. Can you repeat again? What's the major thing?
The question is to what extent should the local specific indices be developed in later analysis? What this brings, like, is it the benefit that we lost things in doing that? What gain we have on doing that?
Yeah, so I understand. So in Vietnam, you might know that the government already approved and use multi-dimensional poverty measurement about 5 years. So the poverty dimension poverty measurement, we start to do the pilot nice inequality in 2010. So it takes 5 years gradually. That's persuade government accepted, and now it belong to government report, and they also apply to measure poverty. So that is, we also want to introduce multi-dimensional inequality measurement for government of Vietnam, and we want them to use it. And why inequality now is more important in Vietnam than poverty? Because poverty in Vietnam now is really low, it's only 5%. And if the government only look at the 5% population, I think that is not good enough, because with the fast economic development in Vietnam, a lot of things change, and we have more inequalities in Vietnam, and it will be the big problem in coming years, not poverty anymore. And poverty, inequality, we really hard to measure by income or expenditure. As you see that in Vietnam, about 70% of people working in informal sector, and then we do not use banking system to change their income, and they often underreport their income for self-employment population. So I think others team like education, health, and participation, and others team can capture a full picture of inequality in Vietnam, and also help the government to have an appropriate policy reduce inequality and target on the rise group, because you see that other aspects like education and health can lead to inequality in income, in participation in other team. So I think we would like to have the same strategy as we opposed for a multi-dimensional poverty measurement. We would like the government will use this framework in the future to measure inequality in Vietnam. Is that I can answer the question, yes or not?
That's perfect. Mrs. Hoa, would you like to complete the...
I just I think Dr. Tung have a great answer. I just add some points here about the locally prevalent or specific index should be developed in later analysis. So actually, as far as I know, in our process here in phase 1 piloted in Vietnam, we have discussed to add some specific index, and MDRI team also add some additional index in voice. For example, we see the proportion of people knowing the name of the prime ministers. So it is like another index. Is not included in the framework, but it also directly reflect the people awareness, the inequalities in the citizen participation. So of course, the first phase we have already had this discussion, and I think if we have in the later case and in years to come to have more analysis on multidimensional inequality in Vietnam. We also apply, of course, this approach. We have the international standards here with very specific indicators, and we also think some indicators that suitable for Vietnam to add on our analysis on the MIF. So I just add some point and hope that is clear for this question.
Yeah, perfectly. Thank you very much. And right now it's we have passed 6 minutes now. So unfortunately, we will have to end this webinar. Thank you very much to all of you. Special thanks to our panelists, and hope this discussion was valuable to you all. And just to let you know, the next webinar in this research conversation series is going to be held on January 6th on the topic of the impact of the 2002 crisis on inequalities in Ivory Coast. So thanks again, and happy holidays to all of you.
Thank you,
Bye-bye.
and everybody. Happy Christmas. Bye-bye.
Bye-bye.
Thank you.
Thank you very much to everybody.
Yeah, thank you. Bye-bye.
Chết rồi.